Hi, I'm Dr. Tyna Moore. I am a chiropractor and naturopathic physician in Portland, Oregon. I've spent the past decade plus specializing in regenerative medicine and musculoskeletal medicine. I most recently have closed my practice to patients, and I specifically now just train doctors like yourself on how to bring their practice into a digital and online marketing world, whether they want to be influencers or whether they simply want to use digital marketing to drive patients to their brick and mortar. Today, I want to talk to you about how to effectively intake a new patient virtually and what are the steps involved. I think I'm going to give you some really basic baseline things that maybe you haven't thought about, but I want to make sure that we're all legal and clear. So the first step you're going to do, obviously, is figure out which telemedicine platform you want to use. Some of them are free, some of them are paid for. Personally, I like to pay for things. A small monthly cost is well worth it when you're having to deal with less glitches and less aggravation. So sometimes spending a little bit of money up front will save you a ton in the end. You certainly don't want a visit crashing and burning because of technical issues because you chose a free platform. So choose what you will, but make sure it's a HIPAA compliant telemedicine platform. The second step, obviously, is to talk to your lawyer. Make sure you can do telemedicine. Make sure that they're aware of what the statutes are in your state. The next thing you're going to want to do is talk to your board and make sure what you want to do is obviously good to go in your state as well. And I know that recent events have changed things a bit, so make sure that you are abreast of the most current information. Then you're going to want to talk to your malpractice and make sure that they're aware that you're going to be implementing telemedicine. And then obviously having a telemedicine consent form that your lawyer draws up. Please don't rely on other people's or other practitioners or colleagues. That may not stand up in court where you are. So make sure that your lawyer is on it on this one. So the next thing you're going to do is what I did in my practice was I simply I had people schedule the same way they always did. They always went through my receptionist. I did not offer online scheduling, although you may want to. It depends on your practice. I like to have more control over my practice than that. The next thing I would do is, so they would be scheduled just like a regular visit. We would make sure that we had payment already in the system. We have a system that is encoded to keep everything safe. And so we would make sure that we had an accurate and up-to-date credit card. And we would tell them generally what the visit was going to cost them. I charged on time always. I have an hourly rate, and that's how I bill. I would then have them all sitting in a virtual lobby. Because of the system I used, I was able to just pull people into the lobby virtually. And I would bring them online to the visit. I'd have the visit with them. Whatever we needed to do, we needed to do. And then I would obviously say, thank you. Your visit today, as discussed, was, I'm going to send you back to my receptionist to talk about what your visit cost was today. Usually they would just say, go ahead and run my card. So however you want to do that, it's a little extra step if they need to get off the call with you virtually and then get on a phone call with your staff, or your staff can email them after. I really like to have payment ahead of time. I don't like to deal with the hassle afterwards. And so I usually just said the price is what it was discussed as, and they would say, okay. So because I knew that I was staying on time. I'm very timely. Like I don't ever get off track on that one. I make sure to honor my patient's timeline as much as my own. Now, as far as getting online for some people, that can be a little challenging because not everybody is technologically adept. And so you might want to make a video that has a screen share option that your staff makes or you make, where you voice over and you show them exactly how to get online. And that might be sent to them in an email prior to the visit so that they're well aware of how to do it. Or you may want to have a staff member talk them through it over the phone. I find that visually people do better with a little bit of a tutorial video that they can watch ahead of time. This might bring some anxiety up for some patients who aren't very good with technology, and that can be a variety of ages, but that tends to be most often be an older population. So that's it. Those are your steps to getting started online and how to effectively intake a new patient virtually. And again, make sure legal stuff is in order, make sure stuff with the board is in order, and then go ahead and make sure you invest in a system that isn't going to give you a bunch of glitches, and proceed as usual and enjoy. And I hope that you have a profitable and wonderful 2020.